New reports from the House Energy and Commerce Committee reveal that Obamacare, that's the Affordable Care Act, not so affordable at all. Premiums could rise anywhere from 100 to 400%. Now, this is for individuals, millions of people who buy their own insurance personally. Congressman Mike Burgess, he's part of the committee that released that report. Congressman, I believe you are a medical doctor, OBGYN. Can you tell me on what basis these health insurance premiums are going to go up so much?
Well, thanks for having me on, Stuart. Trying to get information out of the Department of Health and Human Services on what was going to happen with rates was a lost cause. They weren't replying to us. So we just went to the industries themselves and said, look, how are you preparing for next year? And sent a series of letters. They graciously complied. The information is now all redacted as to company, but it's available on the Energy and Commerce website. And as you point out, 100 to 400% increases in the individual market and small group market. And after all, when the Affordable Care Act was enacted, these were the individuals who were supposed to be helped by this law. So, you know, the president says if you like what you have, you can keep it, but he should have added, but you're going to have to pay up.
But people cannot afford, obviously, that kind of interest. That's at least a doubling in what they've got to pay if they're buying this stuff individually. So they won't be able to buy it. They'll be kicked into the public system. They'll be on Medicaid, will they not? Or they'll go to these exchanges, which are heavily subsidized, which means more expense for the taxpayer.
Well, correct, and of course that is the administration's counterpart to this. That you're not taking into account the generous subsidies that are going to be available to people who earn up to 400% of the federal poverty level. But you know, Stuart, when has a massive infusion of federal dollars actually brought prices down? Did it happen in tuition, in student loans? Did it happen in the housing market? It's not going to happen in this market either, and in fact, costs are going to continue to go up. The only person who is in fact benefited by this that I can see would be the Secretary of the Department of Health and Human Services, because now she holds enormous power over all of the, not just the Medicare and Medicaid part of the healthcare space, but also the private insurers as well. For the first time, they're now regulated by the federal government.
Well, now, the president is embroiled in at least 3 scandals at this point, and I suspect that he's losing political momentum and he's short on political capital. Do you think it's a serious enough situation for the president to have an effect on Obamacare that it might hold it up or in some way unravel it? Do you think?
Well, this has been my thesis for several months. The federal hub, the federal exchange computer piece that is supposed to be ready October 1st, I don't think they can do it. The funding for implementation for furtherance of the Affordable Care Act is going to come due September 30th. I think we're coming to a pivot point this fall where the credibility of the administration will be low. The price tag is going to be exceedingly high. People are going to look at this and say, you've had 3 years, billions of dollars, you're nowhere near ready. Why should we invest one more dime in this?
So could it be postponed? Could the implementation be postponed? So we can't do it on October the 1st or January the 1st. Give us another year. Is that possible?
Well, I'll give them 25 years if they want it, but the reality is you're going to hear things like that. You're going to hear things like de-scoping. We need to narrow the focus of the president's health care law. We're not going to take care of as many people right off as we said. I think these are things you're going to see creep into the discussion. But for my money, October 1st is a critical date. It's a new fiscal year. They're going to need all kinds of new money for implementation. My golly, they're stealing it from the prevention fund as we speak. The secretary is going to these insurance companies and saying, you better give some money to Enroll America because I need this to get the thing accomplished because that darn Congress won't give me any money. The administration has lost so much credibility the last 4 or 5 days that it is going to be difficult for them to maintain the momentum to actually get this thing done. I don't see it.
Thank you very much for being with us. Dr. Mike Burgess, Republican, Texas. Thanks for joining us, sir.
Yes, sir. Thank you.